Welcome to this lesson on OT in pediatric medical settings. After this lesson, you should be able to compare and contrast different medical settings in which OTs provide evaluation and intervention for children and youth, describe some of the common conditions treated in pediatric medical settings, and articulate reimbursement sources in pediatric medical settings. There are several different types of medical settings in pediatric practice, including acute care, specialty units, rehab, and outpatient. We'll begin with acute care. In intensive acute care setting, OT is providing assessment and treatment for children with critical conditions. OT interventions support medical priorities and goals for the child. It's important that the OT in this setting be knowledgeable about any medical precautions a child may have, as well as implications of medical procedures and the use of life support and monitoring equipment. OTs in this setting often focus on prevention of secondary problems resulting from prolonged bed rest, such as contractures, generalized weakness, and decreased endurance that can impact occupational performance. Positioning and the use of orthotics is also common in this setting, as well as education and training for family members. It's also important for OT in the setting to consider the stress on the child and family and implement interventions that will alleviate stress and reintroduce positive social interactions and play for the child and family. Children in general acute settings may have a wide variety of conditions or may be in the acute setting due to a surgery. OT interventions in the general acute care setting focuses usually on ADLs, basic mobility, and family education. Children's hospitals often have specialty units for specific diagnostic and treatment purposes. These may include a focus on orthopedics, cardiac and pulmonary services, and oncology. These are all more specialized areas, and the role of OT will vary. The chapter in Case Smith and O'Brien for this week talks about some of the commonly used interventions in these specialty units in pediatric hospitals. When talking about the rehab setting, that includes subacute, acute, and outpatient settings. Subacute settings refer to long-term facilities for children who are too medically fragile to be cared for at home, but are no longer able to engage in or benefit from the acute hospital setting. OT in the subacute setting focuses on prevention of secondary complications and improved independence. Acute settings include those that I already discussed, the intensive care unit and general acute care units. However, outpatient services focus on ongoing care for conditions and disabilities and provide monitoring and long-term interventions for children. OT interventions in outpatient often focus on health status, development, and improving the child's functioning and participation in home, at school, and in the community. Duration of services in this type of setting may be weekly, monthly, quarterly, or annually. Regardless of the type of medical setting, play continues to be the most commonly used therapeutic approach. It's important to note that OT practice in all of these different types of medical settings have some similarities with the adult and geriatric population as well. Just as there is pediatric acute, rehab, and outpatient and specialty units, the same is true for adults and those in the geriatric population as well. So what are some of the differences between pediatric hospital settings and adult or geriatric hospital settings? One main difference is that children in these types of medical settings may not have a prior level of functioning to return to, so intervention is focused more on habilitation or the building of skills than rehabilitation as it would be for adults. Also, children are constantly changing and developing, so therapists in medical settings have to consider developmental changes the child is experiencing along with the issues related to why you're seeing them in the first place. Another big difference is that play is really the main therapeutic approach when working in medical settings, or really any setting with children, and this often makes it easier to motivate and engage clients in therapy. With adults, it can be tricky sometimes to find meaningful and motivating activities, which can result in the use of more rote exercises. So these are just some of the similarities and differences between pediatric and adult and geriatric medical settings. So who might you see in these medical settings? What types of conditions might you see? Well, it really can be quite the range and variety of conditions. You may see children who have congenital disorders or abnormalities, things like spina bifida and other neuromotor disorders, cleft lip or cleft palate, limb deficiencies, heart and lung defects. You'll certainly see a wide variety of developmental disabilities and delays. You may see different types of diseases such as cancer, organ disease, or rheumatic disorders, as well as children who have experienced things like traumatic brain injury, spinal cord injuries, burns, and infections. Children with multiple medical conditions can really be seen in any of the types of settings discussed. If you work in a medical setting, it's critical that you do your research about the child's condition and be able to communicate effectively with the family and other team members. This is part of the reason that you're doing the conditions presentations in this class, so that you can become familiar with these common conditions as you head out into field work and when you join the workforce. With these different types of conditions, it's important to carefully consider the balance between protection and prevention of harm when encouraging participation in activities. And just as we've discussed family-centered practice in other practice settings, it's again important to incorporate a family-centered approach in medical settings, acknowledging that the parent knows the child best and should be included as an active member of their child's team. Speaking of team, when working in medical settings, OTs are often part of an interdisciplinary team approach. Who else do you think might be involved in the care of a child in one of these medical settings? Take a moment to consider the different types of team members that may be involved in an interdisciplinary approach. So some types of providers that should have come to mind are specialists, nurse practitioners, physician's assistants, nurses, CNAs, social workers or case managers, physical therapists, speech therapists, respiratory therapists, audiologists, and nutritionists, as well as people who help with wound care, bowel and bladder management. There may also be educators and psychologists involved. So it's really important to be familiar with the role of these different team members and understand how to work collaboratively as a team and communicate effectively with one another to help the child and family meet their goals. Being a part of a team is crucial for understanding the child's condition, any changes in their status or treatment plan, and the child's overall needs. Lastly, let's talk about the fun stuff, reimbursement. Who's paying for OT services in these medical settings? There are a variety of payers involved, including private medical insurance plans, Medicaid, special state funding, and potentially Medicare. Billing is done through the use of CPT codes, which describe the types of therapies you're providing, ICD-10 codes, which describe the conditions you're treating, and sometimes letters of medical necessity to justify your treatment or different sorts of equipment that you are wanting to use. It should come as no shock to you that no one wants to pay for what they think someone else should be paying for. So medical insurance doesn't want to cover things that seem to be school-related for a child and vice versa. That wraps up this presentation on OT in pediatric hospital and rehab settings. Be sure to complete the discussion related to OT in medical settings this week as part of your online activities. Thanks.